In Nigeria, the United Nations has projected that about 1.4 million children in Nigeria may die of pneumonia over the next decade. Children under 5 would be most affected. This has prompted calls for the country's health sector to scale up interventions to curb the disease. CGTN's Kelechi Emekalam has more.
Pneumonia is a major threat to millions of children in Nigeria. The chest infection causes fever, cough, and an inflammation of the lungs, which leaves the child gasping for breath. At 20% death rate, it's the leading cause of death of children under 5.
It's one of the infection that is commonly seen in children. Even in Kelechi Hospital here, we see so many of them at every point in time. And except something is done, we continue to see them, and they continue to lose a number of them from this killer disease.
Most pneumonia deaths can be prevented with vaccines and easily treated with antibiotics. But many children are still not vaccinated and do not have access to proper medical care. It's a major challenge for the country, where more than half of its population live below poverty line.
The poor may go to the hospital and they may not be able to afford it, but it is actually available. But we have to ensure that it is now affordable.
So international organizations like UNICEF have been working with the Nigerian government to scale up intervention.
Governments are doing things, so there's a lot going on. There's a lot of focus. In fact, Nigeria has one of the first countries in the world to have a pneumonia control strategy and a guideline to actually control this disease.
Improving nutrition, breastfeeding, and increasing vaccine coverage would reduce the risk of children dying from pneumonia. Over 800,000 deaths could be averted by significantly encouraging and scaling up services to prevent the disease. Kelechi, Emekalam, CGTN, Abuja, Nigeria.